Hello everyone, it's Dr. Tom Chaney from Living Health Integrative Medicine in Annapolis. And in this video, I want to go over 7 critical steps to reversing type 2 diabetes. So I've helped many patients over the years reverse type 2 diabetes, but I see that these 7 steps are key to you reversing your type 2 diabetes. So let's jump in and let's talk about. First, you have to be clear on why you're doing this. I can't emphasize this enough, and this is something I talk to patients about all the time, is really just knowing why you're doing this. That's going to keep you on track. That's going to keep you healthy long term, and it's going to help you just keep out all the noise. So there's going to be things that are going to try to pull you off track when you're accomplishing this goal of reversing type 2 diabetes, and if you're not clear on why you're doing it, you're going to get pulled off track. If you are clear on why this is important to you, then you're going to be able to stay on track, you're going to stay on the program, and you're not going to get pulled off. So, that could be different things for different people. It's usually, very individualized. It's, I hear patients that have told me that, they've seen their friends or family, they've seen them on dialysis, and they don't want to go on dialysis. So preventing complications, that can be a motivator, and that can be your reason why. Or maybe you want to, I had a patient tell me that they're writing a book and they want to make sure that their mind works and their brain works and that they can finish this book, that they're healthy enough to actually complete and publish this book. So different whys for different people. So you really need to sit down and figure out, why it's important for you to reverse your type 2 diabetes and to be healthy. Number 2, you need to start planning and prepping your meals at home. So eating your own food so you can control exactly what is in the food. If you're eating out all the time, I can tell you this is a recipe for disaster. This is going to push you further away from your health goals. You don't know the quality of food, you don't know what's in the food, you don't know how it's prepared. Even if you think that you're making healthy decisions, or at least healthier decisions, I can tell you that the quality of food and what's in that food is sabotaging your health. So you need to just buckle down and get disciplined and make the decision that you're going to eat meals at home, you're going to prep, you're going to go to the grocery store, buy food, prepare it, and take it with you. So if you're going to be at work for the day, take it with you, and make sure you have meals and snacks, and you're planning, you're prepping, and you have what you need when you need it, because if you don't, then you're just going to grab whatever's convenient. And if you're just grabbing what's convenient, then it's probably not going to be the right thing. That's what I've seen. So planning and prepping your food, very important. And in that regard, number 3 is following Dr. Steph's plate rule. So if you guys have been on our website, mylivinghealth.com, on our blog, if you've read any of our books, whether it's the gluten book or Defeat Diabetes, you are familiar with Dr. Steph's plate rule. And this is going to help you so that it doesn't have to take, you don't have to be a mathematician to actually stay on plan. You can look at your meal plate, you know that, okay, this is what it should look like. You don't have to weigh food, you don't have to count calories, you don't have to get into all this points and all these other things, because I haven't seen them to be successful for most patients long term. So this is an easy way that you can just look at your plate and say, okay, this is what it should look like, and you can build your plate around that. So basically it's going to be 3 to 6 ounces of lean protein. So what would be lean protein? Chicken, right? So maybe you grilled some chicken, baked some chicken. All right, we've got our protein. So 3 to 6 ounces of protein, and then we're going to have a significant amount of veggies. So maybe we steam some veggies, or maybe we have a salad. We have that chicken on a salad. That would be your meal. Now, there's also some starchy veggies that you could have. So maybe in that salad you put some avocado, or maybe you had the baked chicken you had some broccoli, steamed broccoli, and then you had maybe sweet potato. Thing we want to just limit. We don't want to overindulge in some of these starchy veggies. So like the sweet potato, maybe we want to only do a quarter of a cup. So we want to take a look and see, make sure we're not overdoing it in that department. So that's Dr. Steph's plate rule. And once again, you can find that on our blog. So go to mylivinghealth.com and then just go to our blog. You can also, and I'll go to our store and I'll show you at the end of this video, I'll show you exactly where you can get our book, which is it's on Amazon. It's also on our store online, and I'll show you where that's at. All right, next one. Let's cut out sodas. So most patients know that's not getting you to your goal. These sodas have lots of sugar, but let's not go to fruit juice, okay? And let's not go to diet sodas either. Fruit juice, if you look at, even if it says 100% organic, real juice, it's got a ton of sugar in it. And if you're a diabetic, that's just going to, once again, push you further away from your goal of reversing type 2 diabetes. It's going to cause an elevation. So avoid the sodas, avoid the fruit juice, and also diet sodas. Diet sodas may not have the sugar, but they do have artificial sweeteners, and we know that artificial sweeteners, they are going to affect the body another way, which also increases the risk of type 2 diabetes. So these artificial sweeteners like sucralose, aspartame, they affect the gut. They've been shown to disrupt the good bacteria in the gut to actually cause a direct increase in blood sugar. And the other place it works on is the liver, which if you're a type 2 diabetic, your liver is not functioning the way it should. Most of my diabetics have already been diagnosed with a fatty liver prior to coming to see me. And then the other place that it's going to work is on your brain, and it's going to just cause you to crave sweet things. So, no sodas, no fruit juice, no diet sodas. Okay, let's get to the next one. Next one is adding more good fats to your diet. So I see that most patients, they have cravings, and a lot of times your cravings come from nutrient deficiencies. So one of the things I see a lot of my diabetics are deficient in is good, healthy fats. So olive oil, great to add to these steamed veggies that I just talked about, or putting on your, making an olive oil dressing that you can use on your salads. So getting these good fats, you can supplement with omega-3 fats like fish oil. We have that on our store as well. Omega emulse is a great supplement. I can show that to you. You can, once again, add, cooking with healthy fats like avocado oil, macadamia nut oil. You can also use coconut oil. Coconut oil is another one. So all of these you can add to your diet. You can get creative. Also, fattier foods like avocado. So getting some good healthy fats from your food is another place to find these. And last one, improving your gut health. So there's a couple different ways to do that, but this is a common problem that I see with diabetics. Most diabetics, when they come to see me, they're on medications, and we know that these medications, they disrupt the good bacteria in your gut. They throw off that healthy balance of good bacteria, and it makes you more susceptible to overgrowths, like maybe a bacterial overgrowth. So bad bacteria can start to set up shop and start to proliferate and really take over. You can also see, what I also see that's common is yeast or fungal overgrowth. A lot of these infections, they like that high glucose, high sugar environment. So I find it common with diabetics. So we want to improve your gut health. Some things that you can use, and I'll go over a couple of products that you can use. We have Gut Repair. It's a great product to help to heal the gut and just get your gut in a healthier state. And then also using some probiotics. So we've got probiotics on our store as well that can also help you. So let me go over and I'll show you some of those products. So if you go to livinghealthmarket.com, so let me move this out of the way. So livinghealthmarket.com, up here, you see that right up on my cursor. Here's our book, Defeat Diabetes, and so you can get that there, and that talks about the plate rule that goes over. I just went over a few strategies. This has 33 effective strategies, so we've been helping diabetics for many years reverse type 2 diabetes. So Dr. Steph and I, we put in this book 33 effective strategies to help you get on the right path. We've seen these tried and true in our practice to help diabetics. One of the things we do with patients in the office is we customize a program, we tailor it for them, we individualize it, we walk them right through the program, and that's why we have such great results, and we see patients regularly reverse type 2 diabetes. Now, if you want to just kind of go through and just start introducing and getting on the right path, this is a great book to do that. It talks about the plate rule in there. Let me go to show you guys gut repair. Talked about that. So gut repair is right here. So this is a great product. It is a powder, and you would just mix this in about 6 to 8 ounces of water. Drink this down, and this is going to be great. One of the main supplements is L-glutamine. L-glutamine helps to heal the gut, and it's going to be great for you to improve gut health. And then I talked about probiotics as well. And so we've got several different probiotics. Probio 350, Probio 100, Probio powder, Probio 300. The biggest difference is different strains of bacteria, good bacteria. We've got different strains in these, and the culture. So 350 is going to be the biggest one we have, or the largest quantity. You can see here it supports a healthy microbiome, replenishes good bacteria in the gut, supports natural immune response, supports lactose digestion, supports bowel regularity. So this is a great supplement, excellent supplement to help with improving gut health. All of these guys here, all these probiotics, whether it's Probio 100, Probio powder, Probio 30. This is a powder, so this is a powder supplement, Probio 350. That's also a powder supplement. The other ones come in a capsule. And so once again, you can just see how this maintains intestinal microecology. It neutralizes certain bacterial toxins, supports a balance of healthy intestinal flora, supports natural immune response, supports bowel regularity. So if you have issues with, I see a lot of patients are not having a regular bowel movement. So really, one a day is not a regular bowel movement. You should be really moving your bowels as many times as you're eating. So, really 2 to 3 times at least. And I don't see many patients doing that. I see a lot of patients coming in, they're going days without having a bowel movement. So not healthy, because it creates this toxic environment. That's how you're getting rid of toxins, is through your, one of the ways is through your bowels. So having a healthy bowel movement. This talks more about the supplement, goes into the different strains of bacteria that's in it. Just kind of gives you all the references as well. Once again, all of our supplements, they have references that support the use. And so, so that's a great supplement as well. All right, guys, so I hope you got some great information from this video. If you have any questions about type 2 diabetes, or if you have any questions about anything that I went through in this video, just drop them down below, and I'll be happy to answer them, and I'll see you in the next video.